Everyone. I'm joined by the Chief Medical Officer, Professor Kelly, and General Fruin, who heads up Operation COVID Shield. We've just had a very positive, practical and cooperative meeting of the National Cabinet of Premiers and Chief Ministers and myself, the 58th meeting in fact, and Omicron, we all agree, presents another new challenge, but we have faced so many challenges already during the course of this pandemic. And on each occasion, we've worked together to ensure that our response across the country and across governments has been able to deliver on the lowest death rates in the world from COVID, one of the strongest advanced economies in the world coming through COVID, and thirdly, one of the highest vaccination rates in the world. So we've seen many challenges before. We are taking Omicron very seriously, as you would expect us to. But at the same time, we are confident that we'll be able to continue to ensure we can face down the most recent challenge, but it does require us to make a number of responses that we've been working through today. That response needs us to appreciate that with Omicron, what we're dealing with is a much greater volume of cases. The cases themselves don't necessarily present the challenge. As we've always said, what really matters is how many people are experiencing serious illness and how many people are having to draw on the considerable resources of ICUs and our hospital system. And the good news today is that hearing from all the premiers and chief ministers, and that although we have seen an increase in the number of cases, we have not yet seen any significant impact on our hospital system. They have been preparing well for challenges that may come, and Omicron has certainly been one of those. But we are seeing in our hospital system them able to cope with the demand as it's presenting. So despite those rising cases, hospitals and health systems remain in a strong position, but of course they'll be tested. And our shared goal is to ensure that we keep it that way when it comes to the protection of our health system to deal with the demands of the new strain of the virus. I also note that this virus strain in Omicron has only been in Australia for less than 4 weeks. So it is still fairly early days. But in our response, we have already seen some major improvements in terms of how the country is moving. We are well prepared for Omicron, but we are not taking it anything other than very seriously in our coordinated responses. There are 3 areas where we agreed to move forward on today in relation to our response, and they fall into the same categories that our COVID pandemic response has been over the course of its entire duration to date. The first are what are called the public health social measures, those basic rules of behaviour that help us moderate the pace of infection and how it moves across the community. The second area is, of course, our vaccination program, as we are now well into the booster phase of that program. And the third area is what's called TTIQ, test, trace, isolate and quarantine. So in turn in those areas, the medical expert panel, as I wrote to the premiers, has set forward a series of recommendations about what they should be doing in those areas. Each of the states and territories will be making their responses to those, but what is very clear, and the Chief Medical Officer and I are practicing that ourselves, and that is mask wearing in indoor spaces in public areas is of course highly recommended. Whether it's mandated or not, that's what we should be doing. In the same way as we go into this summer season, people will be slapping on the hat and slapping on the sunscreen. There's no rule or requirement to do that, but it is strongly recommended health advice. It's in the same category. And so Australians are common sense people and they know what they need to do to protect their own health. And so that is highly recommended, along with all the normal things we've been doing with COVID, and that we don't become complacent about it. The washing of the hands, being very aware of the distancing at all times, trying to maximise your gatherings in outdoor areas rather than indoor spaces where you can. In the summer months, obviously, that is desirable anyway. And so all of these practical things that we can do, we would encourage all Australians to be doing wherever you are, whether you're in Western Australia, up in the Territory, down in Tassie, Queensland, whether you've got in a state which has high cases or low cases. With Omicron, it moves fast, and there is a case at least in every single state and territory. In New South Wales and Victoria, the case numbers are much higher. But in Queensland, for example, we're already at 180 cases, I think, there, and we could expect that to increase in the weeks ahead. So people following common sense behaviours is very important, just as it has been right from the start of the pandemic. Because of the volume of Omicron, it isn't just about what governments is doing. Governments are taking action, and we will take action as a Commonwealth government, but also individuals and communities need to take action as well. And there will be a much greater level of self-regulation when we deal with the volume of cases that are likely to occur in the weeks and months ahead. With vaccines, it is very encouraging now that in a very short space of time, we've been able to lift the daily rate of vaccinations to well up over 200,000 now a day. And we need to keep that going. And I want to thank Australians for turning out for their boosters. We are now doing boosters at a rate of around 100 per minute. And we will see that continue to increase as we go forward. And we need to get back to those record levels of vaccination rates that we saw a few months back. Now, as the country moves past 80%, then we did see the demand at state-based clinics decline. And as a result, some of those facilities were withdrawn. There's about a quarter of them which was stood down. They now need to be ramped up again, and that was a key issue we discussed today. More than 50% of those eligible for boosters have now had them, and they have been predominantly amongst the older population, which are of course most vulnerable. To keep that booster program going, the Commonwealth, I can announce, I advise the Premiers and Chief Ministers today that we'll be increasing the payments to GPs and pharmacists, and we'll be increasing them up by $10 a jab, in addition to what they're already getting now. And we think that's important, particularly over these summer months, when normally, just like many other Australians, they'd be looking to take leave and do things like that. And this is an added incentive to keep that primary care system for delivering vaccines at its as greater capacity as we possibly can have. And we thank the GPs and pharmacists for working with us over in recent times as we've come to that decision. And that was well received by the Premiers and Chief Ministers today. The second thing is to get those state hubs operational again and get them up and running so we can hit those much higher vaccination marks, which at its peak, and General Frewen, I'm sure, will make reference to this, was around 350,000, 360,000 a day. Now, that's where we need to be able to return to those sorts of levels. And remember that when we were at those levels, they were the highest rates per capita of vaccination of anywhere in the world. So they were world's best practice. That's what we've already achieved in our vaccination program. And by combining the work of the primary care with the restored capacity of the state hubs, then the booster program can continue to increase and move forward with confidence. The third area is ensuring we get the right priorities in the booster program. Now, as you'll know, when we went through the first stage of the vaccination program, we were very focused on those who are most vulnerable. Now, by default, the booster program has been focusing on those in recent weeks. We are getting advice from the ATAGI and the other key medical advisors, but particularly ATAGI, on where the prioritisation for boosters needs to continue to go. There's obviously needs in the more vulnerable, and we're working steadily on the aged care populations and others. But we also know that the Omicron strain of the virus, variant, moves very quickly amongst young people. And so we'll be taking more advice on those issues. There's been plenty of discussion about whether the interval should be 5 months, 4 months, 3 months. That will be a decision for the vaccination experts at ATAGI. That is not a decision for myself as Prime Minister or the Premiers and Chief Ministers. The interval will be what the immunisation experts advise, because that also links to indemnity issues that we've put in place around the vaccination program. But whether it's 5 months or 6 months or less than that, the response from all of us as governments is exactly the same, and that is to increase those daily dosage rates from where we've already built it back up to, more than double in the past week or so, and to get it back to those levels that we're experiencing not too long ago with the restoration of the state hub. So there's been no change to the interval. That will be determined by the immunisation experts and no one else. The second issue that we need to focus on is ensure that we maintain the priorities on the 5 to 11-year-olds. That begins on the 10th of January. That priority is not being subordinated. It is going to be pursued in parallel. That remains an incredibly important part of the vaccination program, and we're going to maintain the focus on that, and that is ready to go on the 10th of January, and General Fruin may wish to touch further on that. Now, there's plenty of vaccines. There's plenty. There are 20 million in Australia right now, and about a quarter of those, just over that in fact, are either in fridges, at pharmacies, GPs or in state hubs. They're in trucks on the way to them. So there are plenty of vaccines. The challenge is always, when you've got 9,000 points of presence around the country, is trucks on the road and ensuring they're being delivered. And General Fruin can speak more to that. But there are no supply constraints on the vaccines. And as I said, when we get to those rates, which are already lifting, then we'll be able to maximise the number of jabs in arms, just as we've done before. Now, the third area in test, trace, isolate and quarantine. We've agreed today that we must have a common definition right across the country on what is a casual contact and what are the implications of being a casual contact in terms of isolation, requirement for a PCR test and things of that nature. We cannot have different rules in different places about what a close contact is and what a casual contact is. And there is even an argument which says that there shouldn't be any requirement to have a casual contact definition at all when you're dealing with such a high volume of cases. What matters is how you're managing those close contacts and how they're defined and what you have to do if you are someone who is in that situation. So we've asked the AHPPC within the next, that's the medical expert panel, within the next fortnight to give us a clear recommendation on that, and the Chief Medical Officer will bring a recommendation to that meeting to ensure that we can get that consistency across the country. There is also the issue of QR codes across the country. Now, QR codes will increasingly play a different role into the future. In those states and territories where there are very high numbers of cases, the prospect of tracing every single person who logs into a particular venue is unrealistic and is not a good use of resources. And so you have to focus your resources on their highest yield. What that means is the QR code system is not being used to police people or to impose sanctions on people. What it's being used to is to ensure that people can be alerted through the QR code system about if they've been at a particular place where an infection has been identified, and then the individual, if they are not a close contact, can then and self-manage their response to ensure that they can take appropriate action. And so QR codes and that process will take on different roles as we go forward. In some states with very low cases, they will continue to be using them as for tracing. But in states which have very high case numbers, well, that's not a realistic proposition, but it continues to provide a very helpful role to help in cases with high numbers of cases for people to self-manage, self-regulate their own COVID responses. And then finally, on the issue of testing, we've all seen the terrible queues and the long waits people have had. Some 20 to 25%, 1 in 5, 1 in 4 people waiting in those queues are not symptomatic, they're not a close contact, they're not even a casual contact, they just want to travel to another state. And this is putting unnecessary pressure on the testing system, and it is redirecting resources away from where there is better use of it, in particular in re-establishing the vaccine hubs run by the states and territories. So there was a very good discussion about the impact that public health orders in other states, and it's not just Queensland, other states are doing it, South Australia, Tasmania and others, and Western Australia, are imposing on states from which people are travelling. And there was a positive discussion, and the medical expert panel will give further advice on whether testing is required at all for travel, or we can move to the more simple method of RAT testing, which will reduce those queues and make the system a lot more workable. Now, there are still questions to resolve on all of that. That's understood, but we will take that advice. But it is important that we focus the PCR tests on those who are close contacts and those who are symptomatic, and people who can get those tests and not be standing in queues with other people who are just looking to get on a plane. And what this says to us is that with Omicron and dealing with volume, our systems need to respond differently to the way they did in earlier phases of the pandemic, where, because the case numbers were so much less, you could have more of a direct government intervention and control of these responses. Going forward with Omicron, there will need to be more of a role for individuals in self-managing and self-regulating their responses. Finally, there'll be further work done by the Doherty Institute. That's about forecasting off real cases, real situations, not speculative assumptions, and you would have seen some reporting about that today. That is not a scenario that is envisaged in any way, shape or form, and I can let the CMO add further to that. We'll be meeting again in a fortnight and taking those recommendations and getting further updates, particularly on the issues of severity and what more we'll learn then. But my main message is to stay calm, get your booster, follow the common sense behavioural measures as you're going into Christmas, and we look forward to that. Australians have worked very hard to have this Christmas together, and we want to protect that. One of the things we agreed today is we're not going back to lockdowns. We do not want to go back to lockdowns. And that's why all of these things and the steps we're taking today together in a very calm, methodical, scientifically informed way can mean that Australians can go into this break knowing that Australia is arguably better prepared to deal with this than almost any other country in the world. And if we stick together and work together, as indeed was the spirit of the meeting of Premiers, Chief Ministers and I today, then I think that enables Australia to put the best foot forward.